We followed patients who had undergone transplant, all consecutive patients who had undergone transplantation at City of Hope between 1988 and 2008, so over a 20-year period. And amongst those who had survived 1 year, this was the cohort that we took into consideration. We followed them long term in order to identify those who developed congestive heart failure and matched them with a group of patients who had been followed an equal length of time but did not develop congestive heart failure. It was important to note that we matched them on the following criteria. We wanted to make sure that their age at transplantation was comparable, that the type of transplant they received, i.e. autologous versus allogeneic transplant, was comparable, that they had received an equal amount of anthracycline. So it was an equal exposure and equal ability to develop or equal chance to develop congestive heart failure. So those were the factors that we matched them on, and they had to be followed for an equal length of time also after transplantation. And from this group, we identified 77 patients who developed congestive heart failure and 178 controls who had not developed congestive heart failure. And we compared the set of genes that we were interested in, the frequencies of those genes between the cases and controls. And these genes fell into these broad categories: genes responsible for metabolism of anthracyclines, genes responsible for iron homeostasis, genes responsible for making sure that the reactive oxygen species were cleared, and then genes responsible for left ventricular remodeling.